Hello, everyone. Today we're going to be talking about local delivery mechanisms, such as Atridox. It's going to be presented by me, Hunada, and my friends Pooja and Shams. When treating periodontal disease, not all deep pockets are indicating for surgery. There may be times when a moderately deep pocket can be treated with a combination of deep scaling and root canning coupled with a locally delivered antibiotic that is released slowly over a period of time. This is going to be pain-free management, and the research shows improvement in pocket depth when used in indicated sites. So sometimes of local drug delivery systems in management of periodontitis is going to be like a nano or micro drug delivery system, irritating system, sometimes fibers, strips, films, and gel system. Atridox. Atridox is a chemical agent that have been incorporated into controlled release devices. Doxycycline hyclate gel is marketed under the brand name of Atridox. Doxycycline is in a class of antibiotic called tetracycline. Atridox is a gel system that delivers the doxycycline to the periodontal pocket. Let's talk about the description of this drug. This medication is a pale yellow to yellow gel with concentration of 10% of doxycycline hyclate that the dental professional places into the infected tooth pocket. When applied to the infected tooth pockets, this medication works by preventing the growth of bacteria. It becomes wax-like when it comes in contact with the cervical fluid. Doxycycline is then slowly released from the hardened gel over the next 21 days. The gel is biodegradable, so there's no need to remove from pockets.
Let's talk about the Atridox. Atridox is a recently developed gel system for the local antimicrobial drug delivery into the periodontal pocket, which incorporate doxycycline in syringeable gel system. There is two syringe. Syringe A contains 450 milligram of Atrigel, which is liquid, and syringe B contains doxycyclic hyclate, which is 42.5 milligram of doxycycline. Let's talk about how the mixture of doxycycline hyclate gel and Atridox occur. First, syringe A contains the liquid, which is red strip and containing liquid polymer of the Atrigel, which syringe B contains the doxycyclic powder. Inject the content of syringe A into the syringe B and then push content back into the syringe A. This mixture syringes back and forth for 100 times, which is about 1.5 minutes of time. The content must be in syringe A when finished. The third step is hold the coupled syringe vertically with the syringe A at the bottom. Pull the back on syringe A and plunger and allow the content to flow down the barrel for several seconds. Uncouple the two syringes and attach the blunt cannula to syringe A. How the administration of Atridox. First, bend cannula to resemble a periodontal pocket, which is more adjustable form. When filling the periodontal pocket, keep cannula tip near to the periodontal pocket. Fill the majority of the pocket with the Atridox while withdrawing the cannula tip from the pocket. Tip is you may benefit from the use of moistened hand instrument to ensure proper placement. The third, separate the cannula tip from Atridox is easy. Simply turn the tip toward the tooth surface and by pressing the cannula tip on the surface of the tooth, Atridox will easily separate from the cannula tip. The side effect of Atridox, which include gum discomfort because of Atridox become the hard after the placement, pain might be occur, soreness and toothache also occur. Tooth loosening is most common side effect of Atridox. Jaw pain, allergic reaction, rash, itching and swelling, severe dizziness, difficulty in breathing and discoloration of the tooth.
Here is some adverse reaction to Atridox. There is a possible adverse reaction include oral candidiasis. There is an allergic response. The use of antibiotic preparation may result in the development of bacterial resistance. Post instructions. First, do not brush the treated sites for the first 12 hours after treatment. Do not floss a rubber or place a rubber tip or a toothpick in the treated sites for 1 week following the procedures. You may resume your normal oral hygiene after 1 week. Your periodontist may require you to return for a 1-month re-evaluation depending on the depth and location of the pockets. You may have some discomfort after placement of Atridox. So it's important to take over-the-counter pain relief medications such as Advil or Tylenol. Avoid hard, crunchy, spicy food. Here is a video about Atridox.
In the healthy mouth, gums are pink and close to the tooth. When probed, there is no bleeding, and the probe typically reaches in 3 millimeters or less. With periodontitis, the gums begin to recede and pockets develop between the gum and the tooth. This is due to the presence of bacteria, most often a group of bacteria, including P. gingivalis and T. forsythia. When probed, the gums bleed and the pockets can be 7 or more millimeters deep. An antibiotic such as doxycycline can kill the bacteria and help the gums become healthy again. In the past, there have been problems with administering an antibiotic to periodontal pockets. The difficulty was obtaining access to the bottom of the pocket and preventing the fluids in the pocket from washing it away before it has a chance to work. Now, with the unique gel delivery system of Atridox, this is no longer an issue. Atridox is a subgingival controlled release system composed of a delivery system, which is a bioabsorbable, flowable polymer gel combined with a doxycycline hyclate powder. When mixed, Atridox becomes an easy-to-apply gel that flows to the bottom of pockets and fills even the smallest spaces between teeth and gums. On contact with the crevicular fluid, the liquid Atridox solidifies and then allows for controlled release of the drug for a period of 21 days. Only Atridox is clinically proven and indicated to achieve all 3 of these outcomes: gain in clinical attachment, reduction in probing depth, and reduction in bleeding on probing. Additionally, Atridox has been shown to reduce the levels of red complex bacteria that are associated with periodontal disease for at least 6 months.
Thank you. Here are some questions. The first question is, how long does it take to release doxycycline? A, 7 days, B, 3 days, C, 21 days, D, 1 month. The answer is, it will take 21 days. It's a controlled release of doxycycline. Question number 2, all of the options are adverse reactions to Atridox except one. A, itchiness, B, bleeding, C, tooth loosening, D, jaw pain. The answer is B, bleeding. Question number 3, patient can brush after 6 hours of applying Atridox. True or false? The answer is false. Thank you. And here is some references. And thank you for your listening to our presentation.